Welcome to our channel. Today, we're diving into a crucial health topic, the causes of blood in stool, also known as rectal bleeding. Seeing blood in your stool can be alarming, but it's not always a cause for panic. Blood in the stool can come from anywhere along the gastrointestinal tract, from the mouth to the anus. We'll cover a variety of causes, from common conditions like hemorrhoids to more serious issues such as colorectal cancer. Our goal is to empower you with knowledge so that you can take informed actions regarding your health. So let's get started and explore the different reasons you might be seeing blood in your stool. Stay tuned, and let's dive in. Hemorrhoids are one of the most common causes of rectal bleeding. These swollen blood vessels in your rectum or anus can cause bright red blood to appear on toilet paper or in the toilet bowl. Hemorrhoids can also be accompanied by itching, discomfort, or even pain in the anal area. The causes include straining during bowel movements, chronic constipation, and prolonged sitting. Lifestyle changes like increasing fiber intake, staying hydrated, and avoiding prolonged sitting can help manage and prevent hemorrhoids. Over-the-counter treatments like creams and suppositories can provide relief. However, if your symptoms persist or worsen, it's important to see a healthcare provider. Persistent rectal bleeding should always be evaluated by a healthcare professional to rule out more serious conditions. Anal fissures are small tears in the lining of the anus, often caused by passing hard or large stools. These tears can lead to bright red blood and pain during or after bowel movements. The pain can be sharp and intense, making each trip to the bathroom a dreaded experience. Treatment often involves measures to soften the stool and reduce straining during bowel movements. Increasing your fiber intake, drinking plenty of water, and using stool softeners can help. Warm sitz baths can also provide relief by relaxing the anal muscles and promoting healing. In more severe cases, medications such as topical anesthetics or muscle relaxants may be prescribed. As with any rectal bleeding, it's important to consult a healthcare provider to ensure the proper diagnosis and treatment. Diverticulosis refers to the presence of small pouches, or diverticula, in the wall of the colon. These pouches are generally harmless unless they become inflamed or infected, a condition known as diverticulitis. When these pouches bleed, it can result in blood in the stool. Symptoms of diverticulitis include abdominal pain, fever, and changes in bowel habits, in addition to rectal bleeding. For mild cases, increasing fiber intake, staying hydrated, and using over-the-counter pain relievers may be sufficient. More severe cases may require antibiotics to treat infection, or even surgery to remove the affected portion of the colon. If you experience symptoms of diverticulitis, such as severe abdominal pain, fever, or persistent rectal bleeding, it's crucial to seek medical attention. Early diagnosis and treatment can prevent complications and ensure better outcomes. Colorectal polyps are growths on the lining of the colon or rectum. While often benign, some polyps can bleed if irritated or large. Blood in the stool can be a sign of colorectal polyps. Colonoscopy allows doctors to detect and remove polyps. Regular screenings and a healthy lifestyle reduce the risk of polyps. Colorectal cancer is a serious condition that can cause bleeding in the digestive tract. Symptoms include blood in the stool, changes in bowel habits, weight loss, fatigue, and abdominal pain. Early detection of colorectal cancer is crucial for successful treatment. Screening methods like colonoscopy can detect colorectal cancer at an early stage when it is most treatable. Treatment typically involves a combination of surgery, chemotherapy, and radiation therapy. Prevention strategies include maintaining a healthy diet, staying physically active, and avoiding smoking and excessive alcohol consumption. Regular screenings for colorectal cancer are recommended for individuals over 50 and those with a family history of the disease. If you experience symptoms such as rectal bleeding or significant changes in your bowel habits, consult a healthcare provider promptly. Inflammatory bowel disease includes Crohn's disease and ulcerative colitis, causing gastrointestinal inflammation. Symptoms include blood in the stool, abdominal pain, weight loss, and fatigue. Crohn's affects the entire digestive tract. Ulcerative colitis targets the colon and rectum. Treatment involves medications to reduce inflammation and control symptoms. Lifestyle changes like diet and stress reduction help manage IBD. Gastrointestinal infections caused by bacteria, viruses, or parasites can lead to inflammation and bleeding in the intestines. Symptoms include diarrhea with mucus or blood, abdominal cramping, fever, and nausea. Common pathogens responsible for these infections include Salmonella, Shigella, and E. coli. Infections can be contracted through contaminated food or water, poor hygiene, or close contact with infected individuals. Treatment often involves hydration, rest, and in some cases antibiotics or antiparasitic medications. It's important to maintain good hygiene practices such as washing hands thoroughly and avoiding contaminated food and water to prevent these infections. If you experience persistent symptoms or severe diarrhea with blood, it's crucial to seek medical care. Early diagnosis and appropriate treatment can prevent complications and promote a speedy recovery. Peptic ulcers are sores in the stomach or duodenum, often caused by Helicobacter pylori or NSAIDs. These ulcers can bleed, resulting in dark, tarry stools known as melena. Symptoms include abdominal pain, nausea, and vomiting. Treatment involves antibiotics and reducing stomach acid with medications. Lifestyle changes like avoiding NSAIDs and reducing stress can help manage ulcers. Early treatment can prevent complications like bleeding and perforation. Angiodysplasia is a condition characterized by abnormal, fragile blood vessels in the colon that can cause bleeding. This condition is more common in older adults and can result in blood in the stool, which may be mild or severe. Diagnosis often involves endoscopic procedures such as colonoscopy, which allow doctors to visualize and sometimes treat the abnormal blood vessels. Treatment options include cauterization of the bleeding vessels during endoscopy, or more advanced procedures if necessary. If you notice recurring blood in your stool or have risk factors for angiodysplasia, such as advanced age, it's important to consult a healthcare provider. Early diagnosis and appropriate treatment can help manage symptoms and prevent complications. The blood is usually bright red, indicating it comes from the lower part of the digestive tract. Proctitis is inflammation of the rectum lining, causing rectal pain, mucus discharge, and blood in the stool. Symptoms include a constant urge to have a bowel movement and visible blood or mucus in the stool. It can be caused by sexually transmitted infections like gonorrhea, chlamydia, or herpes, or by inflammatory bowel disease or radiation therapy. Treatment depends on the cause, including antibiotics or antiviral medications. Seek medical evaluation for symptoms. Meckel's diverticulum is a congenital abnormality that results in a small pouch in the intestine, which can become inflamed and bleed. This condition is present from birth and is more common in children. Symptoms include painless rectal bleeding, which may be significant, and in some cases abdominal pain or discomfort. Diagnosis often involves imaging studies such as a Meckel's scan, which uses a radioactive tracer to detect the presence of the diverticulum. Treatment may involve surgical removal of the diverticulum, especially if it causes significant symptoms or complications. If you or your child experiences unexplained rectal bleeding, it's important to consult a healthcare provider for evaluation. Early diagnosis and treatment of Meckel's diverticulum can prevent complications and improve outcomes. Upper gastrointestinal bleeding refers to bleeding from the esophagus, stomach, or duodenum, which can cause dark, tarry stools known as melena. Common causes include esophageal varices, gastric ulcers, and gastritis. Symptoms include melena, abdominal pain, nausea, and vomiting. Diagnosis often involves endoscopic procedures such as esophagogastroduodenoscopy, which allows doctors to visualize the source of the bleeding and sometimes treat it during the procedure. Treatment depends on the underlying cause and the severity of the bleeding. It may involve medications to reduce stomach acid, endoscopic interventions to stop the bleeding, or surgery in severe cases. If you experience symptoms of upper GI bleeding, it's important to seek medical care promptly. The dark, tarry appearance of the stool is due to the breakdown of blood by digestive enzymes. Ischemic colitis occurs when reduced blood flow to part of the colon causes inflammation and bleeding. Symptoms include bloody diarrhea, abdominal pain, and cramping. The reduced blood flow can lead to tissue damage and ulceration, resulting in blood in the stool. Diagnosis typically involves imaging studies such as a CT scan, as well as colonoscopy to assess the extent of the inflammation and bleeding. Treatment focuses on addressing the underlying cause of the reduced blood flow and managing symptoms. This may include medications to improve blood flow, antibiotics to prevent infection, and supportive care. In severe cases, surgery may be necessary to remove damaged portions of the colon. If you experience symptoms of ischemic colitis, It's important to seek medical attention to prevent complications and ensure appropriate treatment.